Frontline healthcare workers are among the first to receive the coronavirus vaccine. And one of them is our own NBC News medical contributor, Dr. Natalie Azar. She is about to get her first dose. She's standing by. Dr. Natalie, good morning to you. You ready?
How are you? Yeah, I'm ready.
We understand.
I am ready, Craig.
I know you are. We understand you're getting the Pfizer vaccine, Dr. Natalie. Was there any consideration to which vaccine you would get, Pfizer versus Moderna?
No, Craig, I think, honestly, for the foreseeable future, the vaccine that you are offered is the one that you will be able to get. I don't know we'll ever get to a point in time where people can pick and choose, and thank goodness they all have about the same efficacy and safety, so we're good.
And Dr. Natalie, I know it's a little tough to hear because you're not alone in that makeshift vaccine bay. There are other doctors also getting the vaccine with you. What is the mood like? Does it feel like Christmas come early?
You know what, Dylan? Honestly, there's so much excitement. You think that we were all lining up to go to a concert. It's the whole workforce here at NYU. We're all here together, nurses, patient-facing staff. Anybody who takes care of patients is here getting it. We're all rolling up our sleeves, anxious and excited to be able to do it.
And Dr. Natalie, let's get to it here. I know Nurse Regina is standing by there. Let's get the nurse in and
Pfizer vaccine today.
Smart. She's got the short sleeves on.
Oh, yeah. Dr. Natalie,
I'm going to ask you several questions to consent you for vaccination.
Okay.
All right. So, do you feel well today?
I feel fine.
Did you receive any vaccinations in the last 14 days?
I have not.
Did you have any severe allergic reactions to anything before?
I have not.
Okay. Did you receive any COVID antibiotic treatment in the last 90 days?
I have not.
Did you receive any steroid treatment, or do you have any autoimmune diseases?
No.
Okay. All right.
She passed the test.
Good to go.
All right.
I did.
Okay, so I am going to give you your vaccine now.
I'm excited.
Yes, that's a history
Doctor,
now.
I know.
Very exciting. We're going to eradicate this COVID.
Dr.
Yeah,
Natalie, you can still hear us, right?
Yes, sir.
I'm going to try and distract you just in case.
Oh, yeah, thank you.
That needle that she's using, is that pretty much the same kind of needle that they use for the flu shots?
Oh, yeah.
Okay.
This is an intramuscular. It goes into the muscle. It's going to feel just like a flu shot. And I heard that Regina has a very gentle hand, so we'll be good.
And I know you've been on the front line since this whole thing started. It's got to be a relief to get the vaccine, but what is life going to look like for you starting tomorrow? Are we still looking at the masks? Are you still socially distancing?
Almost done, yes.
Life is not going to look any different for me. This is something that we really, really want to communicate very clearly to folks, that even after you are able to get a vaccine, you're still doing everything the same. You're wearing your mask when you're not in your household. You're still keeping your distance. You're still washing your hands, because one of the big unknowns is whether or not, if you've had the vaccine, can you still transmit to somebody? Mm-hmm. So until we get to that place where 70% of the country is immunized, we can't make any assumptions about that. And so my life will continue the way it is. I will wear my PPE when I see my patients, and I'm going to wear my mask when I'm outside of the house.
Hey, Dr. Natalie, really quickly before we let you go, you posted something on Instagram we wanted to ask you about. You're donating blood. You've donated blood before the vaccine, and you're going to donate more blood after the vaccine, and we're going to test the blood.
Right.
What is that test going to tell us?
So this was really interesting. We got a text from one of my colleagues, 2 days ago, who's one of the lead investigators in many of the research trials here at NYU. One of the things that is the big question mark about the vaccine is how long the immunity lasts once you get it. And in a population of our patients, for example, who are, compromised, have compromised immune systems, do they even mount a really good vaccine response? And if they do, how long does it last? So we were volunteered as healthy controls. So I gave blood yesterday. I'll give blood again in 4 weeks and then again in 6 months to see how my immune cells responded to the vaccine and how long my immunity is compared to people who may not have as robust an immune response.
Well, Dr. Natalie, we are thrilled that you just got that shot in your arm. Keep us posted. Let us know if you have any side effects. But congratulations, Dr. Natalie Azar.
I sure will.
Thank you. Thank you. Thank you.
Thank you. One down, one to go.
That's right.
Absolutely. And it's nice to see all the doctors we check in with getting the vaccine and showing us it's easy.
Yep.
You get it, and we'll see what happens.